Good morning, Madam Chair and members of the committee. First, I'd like to thank the Chair and the committee staff for all that you've done on working on this bill. AB 260 is an important proposal to protect safe and legal reproductive health here in California. Access to reproductive health care, including abortion, continues to be under threat across the nation. Since the Dobbs decision 3 years ago, other states have been restricting or banning abortion care and people's ability to make decisions over their own bodies. The federal government has already made cuts to critical funding for family planning in an effort to further restrict the ability of states to provide essential health care. Just a few weeks ago, the U.S. Health and Human Services Secretary said he directed the FDA to reevaluate its approval of safe abortion medications. AB 260 is in response to these very real threats. This bill protects access to medication abortion here in California, specifically mifepristone, a common medication abortion drug first approved by the FDA in 2000. Medication abortion is safe and it's effective, and it's the least invasive option for abortion care based on decades of FDA research. Access to full scope of reproductive health care is critical for Californians and their health care providers so they can make the best decisions for their health and their families. This is especially true for people living in the areas with few providers or those that have to travel long distances to get care. This bill provides critical protections in California for medical professionals who are helping their patients to get health care they need and the patients themselves. Specifically, this bill protects healthcare providers, pharmacies, clinics, and hospitals from disciplinary action or licensing impacts that are legally providing mifepristone. Following the passing of similar policy in New York State, this bill allows reproductive health care providers' names to be removed from medication abortion prescription labels. The bill also allows for patients' names to be removed from prescription labels to make sure they aren't targeted for the use of mifepristone. Health plans will be required to continue covering medication abortion, making sure this essential care remains affordable for those who need it. Finally, this bill expands access to telehealth services, making sure more people, especially our folks in rural and underserved areas, have access to safe and reliable remote health care. Senators, the federal government has already shown us it intends to roll back access and funding for reproductive health care. It is more important than ever that we stand strong in protecting the rights of Californians and their health care providers. This is a proactive step to make sure our people keep accessing the reproductive health care regardless of changes at the federal level. People having access to the reproductive health care not only secures the rights of their own bodies, but makes for healthier communities across California. With me today to testify in support are Adriana Benedict, General Counsel at Hey Jane, and Tiffany Brokaw, Deputy Attorney General with the California Department of Justice.
Welcome to you all. So I assume one of you is just here for technical questions. Great. And then 2 minutes to the other two of you. Go ahead when you're ready.
Good morning. My name is Adriana Benedict, and I serve as General Counsel for Hey Jane, a leading provider of primarily virtual telehealth abortion care. Hey Jane's providers have courageously served over 80,000 patients since 2021. While intimidation is not new to our providers, the last 6 months have seen an undeniable escalation of threats that seek to use fear to accomplish reproductive health care bans, which cannot be accomplished through the ballot box. Fortunately, brave public servants have resisted these efforts. Within days of Louisiana seeking to impose criminal liability against a provider, Governor Hochul of New York signed into law an exception allowing prescription labels for abortion medication to be labeled with the provider's practice information instead of their personal information. When Texas sought to impose civil liability on a provider based solely on their name being found on a prescription bottle, a county clerk refused the judgment filing based solely on New York's SHIELD law. When a federal bill to repeal the Freedom of Access to Clinic Entrances, or FACE Act, was debated before being passed out of the Senate Judiciary Committee recently, Democratic senators retold the harrowing stories of violence that led to the bipartisan passage of the FACE Act over 20 years ago. And when a domestic terrorist was found with a hit list just a week ago, including abortion providers, after murdering a politician and her spouse and severely injuring 2 others, law enforcement worked with appropriate stakeholders to notify at-risk abortion providers without delay. Unfortunately, a federal court decision from Thursday will inevitably balloon the magnitude of these threats. In Pearl v. HHS, the sole federal judge sitting in the Northern District of Texas overturned the entirety of the 2024 Reproductive Health Privacy Rule, which the U.S. Department of Health and Human Services had promulgated under HIPAA to heighten protections for reproductive health care PHI. AB 260's protections for reproductive health care providers and patients, including the exclusion of names from prescription bottles, has never been more urgent. In times like these, providers rely on public servants like you to continue advancing access to reproductive health care. We strongly support the passage of AB 260 with its crucial urgency clause. Thank you.
Thank you very much. Go ahead.
Good morning, Chair and members. Tiffany Brokaw, Deputy Attorney General with the California Department of Justice, here on behalf of Attorney General Rob Bonta, who is proud to co-sponsor AB 260, and thanks Majority Leader Aguilar Curry for carrying this important piece of legislation. AB 260 would make various changes to ensure continued access to abortion medication, including shielding providers from liability for administering this medication and establishing privacy protections by authorizing pharmacists to dispense this medication without the patient name, prescriber name, or the pharmacy name. Since the overturn of Roe v. Wade in 2022, abortion access has been under attack, and there have been emerging threats nationwide. 63% of abortions are done using medication abortion, up 10% from 2020. So it is crucial that we ensure its continued availability. Studies show that this medication is safe, effective, and it is one of the least expensive ways to do this. It plays an important role in reducing barriers and promoting equitable access to healthcare, particularly for those who live in rural and underserved communities. AB 260 is an important part in keeping California a safe haven for reproductive access, and for these reasons, we request an aye vote on AB 260. Thank you.
Thank you so much, and thank you both for testifying here today. Are there others in the room in support of AB 260? If so, please come to the mic and share your name, organization, and position on the bill.
Thank you very much. Vanessa Kahina with KP Public Affairs on behalf of the California Academy of Family Physicians, here in support.
Good morning, Chair and members. Sosin Madanat, W Strategies here on behalf of California Nurse Midwives Association in strong support.
Good morning, Genevieve Schweitzer on behalf of Lieutenant Governor Eleni Kounalakis as a proud co-sponsor in support. Thank you.
Connie Chan on behalf of State Treasurer Fiona Ma, proud co-sponsor.
Thank you.
Martin Radosevich on behalf of Reproductive Freedom for All California, proud co-sponsor.
Chair and members, Kathy Mossberg with Essential Access Health, proud co-sponsor.
Ryan Spencer Bath, the American College of OBGYNs, District 9, also a co-sponsor.
Good morning, George Soares with the California Medical Association in support.
Thank you. All right. Is there lead opposition to AB 260? If so, come on up to the table here. We have this extra seat. You'll have 2 minutes. When you're ready, go right ahead.
Yes. All right, Chair and members, my name is Greg Burt with the California Family Council, and I urge you to reject AB 260. While promoted as a safeguard for reproductive freedom, the bill is dangerously prioritizing abortion politics over women's real health and real safety. AB 260 permits pharmacists to dispense mifepristone without the name of the prescribing doctor or pharmacy listed on the bottle, a practice intended to shield providers from out-of-state prosecution. But this secrecy comes at a cost. Women deserve transparency, especially when taking a drug that ends the life of a precious unborn baby and can seriously cause serious complications for the mother. The bill claims mifepristone is safe and effective, yet a groundbreaking 2004 study analyzing over 860,000 of these drug-induced abortions found that more than 1 in 10 women suffer serious adverse events, far higher than the previously is been advertised. Now, why is this? Because safeguards have been quietly stripped away at the federal level. no in-person exams, no confirmation of gestational age, no follow-up care mandated. Instead of addressing these risks, AB 260 doubles down on this hands-off approach, shielding providers from accountability and preventing law enforcement access to prescription records without a subpoena, even in cases where something has gone terribly wrong. Here's what you don't hear from Planned Parenthood. Medicaid data reveals that over 80% of ER visits after mifepristone abortions are misclassified as miscarriages. That's a truth, a crisis in truth, not just medicine.
Okay, your 2 minutes has expired. Thank you for your testimony. Are there others in the room with Me Too testimony who would like to oppose AB 260? Seeing no one, I'm going to come back to the dais. Colleagues, comments? Okay, moved by several members. Assemblywoman, would you like an opportunity to close?
I would. I want to thank all of you that are here today and that we've worked very hard on this. AB 260 is an important part of us protecting reproductive health in California. But it is not just about protecting a pill, it's about protecting our people. Think about that. That's what we're doing. It's about making sure Californians can make decisions about their own bodies without fear or interference. It's about standing with our health care providers who show up every day to deliver safe, compassionate, research-backed health care, often under increasing political pressure and scrutiny. This bill is necessary to protect access to health care, to protect providers, to protect the right to choose, and to protect all women. Thank you very much. I respectfully ask for your aye vote.
All right, we have a motion. Let's call the roll.
Motion is due pass the Senate Appropriations Committee. Ashby?
Aye.
Ashby, aye. Choi?
No.
Choi, no. Archuleta?
Aye.
Archuleta, aye. Adeguin? Grayson?
Aye.
Grayson, aye. Menjivar? Menjivar, aye. Nilo? Smallwood Cuevas? Smallwood Cuevas, aye. Strickland? Humberg? Weber Pearson? Weber Pearson, aye.
Okay, so that's 6 to 1. We will put that item on call. Thank you, Assembly Member.
Thank you very much.